My name is Dr. Kayla Padayachee. I am a research assistant at the Center for the AIDS Program of Research in South Africa, or CAPRISA. At our institution, we primarily address HIV, issues relating to prevention, treatment, epidemiology, and HIV pathogenesis. In recent years, our focus has been shifted to COVID as well. We do have a microbiome program where we do undertake these research related to STIs and how they affect women and adolescent girls and young women, actually, who are the most affected population. The African population is very diverse, and there are genetic variations and similarities between us and between populations across the world. I believe that genomics would offer us opportunity to sort of delve into these genetic variations and allow us to tailor interventions that could target these specific genetic differences. This would obviously also provide us insights into developing diagnostic tools. I definitely think that the bioinformatic analysis would be most helpful. We generate a huge amount of data from clinical trials. From that point of view, data analysis is key, and I think public health in South Africa in the future should be largely data-driven, because we are facing these infectious diseases. We don't know when the next outbreak could happen, and we need to be prepared to handle these large amounts of data. For us back home, not many people have that skill. Only a few are able to actually interpret the data and understand, okay, what exactly is being said, what exactly does this show. So I think definitely starting now, training others with the knowledge, employing more bioinformatic tools to doing our own analysis on our own samples would definitely give us an upper hand. I would just like to acknowledge BGI for this opportunity. BGI is future of genomics. It is a state-of-the-art institution with cutting-edge research, equipment, facilities, expertise, resources. We are learning about basic Linux commands, R Studio, everything related to data analysis and management. I feel like the tools that we learn here will ultimately enable us to progress public health in our countries. I would take this knowledge back to my country and apply it to relevant situations. We just did the virtual pandemic seminar, which tested our abilities to handle outbreak situations in a simulated scenario. It was interesting because working with a lot of people, we had sort of difficulties navigating, the plan. We had to decide what equipment do we use, what is the actual procedure. We had to bring in all our knowledge to decide the best way forward in terms of outbreaks in Africa, not just South Africa alone. I think for me, that was very stressful. We have differing opinions, but at the end, it came together. And we did have assistance from the team at BGI who provided the insights about sequencing, the equipment that we could use, how BGI could be integrated into the South African health system. It was interesting to learn about some of the experiences, especially I think some of the presenters did mention going to Saudi during the pandemic. It was interesting to see how BGI dealt with the pandemic and what we could learn from them. I think another thing that I think is noteworthy to mention is individual projects that we've been doing. So ours was phage therapy, and phage therapy is not at the moment widely used in African settings because of the cost, but its applications to antimicrobial resistance is actually it's very good. I think everyone at BGI is very wonderful. They've been very helpful right from the beginning, very accommodating, very considerate towards our needs, whether it's like in terms of the actual training or our personal needs. If we are stuck or we are facing an issue that we haven't experienced before, they always weigh in, provide input for us, and make sure that we are taken care of. Everybody has always tried to make us feel welcome here and assist us, whether it's at night or early hours in the morning. We have made lots of new friends from lots of African countries, potential collaborations. We've been on several tours together, so we've gotten to know each other on a personal level. It's good to see that everybody is on the same wavelength. We have the same issues as a continent. We are facing very similar issues. So seeing and meeting other people with the same sort of outlook as you has been really remarkable. Everybody has a similar goal. Everybody has the same interests and puts their passion in front of, like, at the forefront of everything that they do. Africa needs this collaboration. They need international influence. They need investment. They need growth. Thanks to BGI for this opportunity, and we hope in the future that collaborations, idea exchange, resource exchange, trainings, meetings, everything would come together nicely, and we could together make global change.